Hi everyone, this is Dr Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to the Equine Functional Posture Podcast. Today we're talking about belly lifts, which is an exciting topic, but I just wanted to remind you that this is the last week that you can join the upcoming Equine Functional Posture course, which is a 6-module, 6-week course, and it begins on the 3rd of November. So if you're interested, then you'll find the link below to join that, and yeah, we'd love to have you on board. How are you going today, Soph?
Hi, Raquel. I'm going well. We've been chatting about the belly lift because it's such a common exercise, and I actually remember learning it as a 10-year-old going to riding lessons and being encouraged to use, a hoof pick underneath the horse's belly to get them to lift up and to see their back raise. And that seemed to be something that I was also seeing in Hoof Beats. The Hoof Beats magazine, I remember reading an article about it. My dad used to buy me that magazine as a horse mad kid. So yeah, it's definitely something you see often, and there's been so many good discussions about its role in where to use it, how to use it. It's just something that we wanted to talk about today to give some extra clarity to the topic.
Yeah, it is a really valuable exercise, but it's important to understand, what we're actually looking for with it, how we can apply it, and then indications that the horse is kind of struggling with it. Like it can really open up the back. And, because when we ride the horse, often they're not as strong as we would like them to be in flexion. And so we're often putting stress into extension. So this really opens up the ability for the back to lift and flex. It's also really important for as well as the spinal joints, but the rib heads, the sternum, the whole body's actually involved in this exercise. It's not just a core exercise. There's a lot of ligamentous structures, muscular structures, and we can really get an idea about the connection through the entire body. So if we're kind of talking about, well, why do we want to do a belly lift? What kind of things come to mind for you?
So the first one being that you're recruiting your postural muscles. So if you're doing a belly lift, it's usually in a static position. And so you're asking the horse to, like you said, lift and engage the back. So you're getting that rounding response, but also contracting underneath the belly. In a good belly lift, you see a gentle motion through the head and the neck. And so the horse isn't moving and using their big locomotory muscles, but they are recruiting their postural muscles. So that's really important. It's also used for checking for thoracic function. So again, function we're talking about, is the motion available? Is that range of motion there for the horse to move into? So it's very good for decompressing the base of the wither, because you can imagine as the back lifts, the wither has to open at the top. So you're looking for that thoracic flexion. Can they open? You're also looking for connection and balance throughout the whole body. So like Raquel said, it connects the head and neck, the thoracic sling, the core, and the pelvis. So looking for function through that whole space. There's a lot of moving parts, soft tissue, and bony structures throughout that space. What else? What comes to mind for when you'd use a belly lift?
Yeah, I mean, it can also be utilized in different ways. So, for example, you can use it as an activation to kind of switch the core on, or you can use it in more of a lengthening way where it's a lot more gentler, you're holding it for longer, and it's more of a stretch and a lengthening of the top plane. So You can use it in different situations, like before work as more of an activation, post work as more of a lengthening. And I think that's the same with a lot of exercises, how you execute the exercise depends on what your aim is in that moment, like what you're actually using it for. The other thing to recognize is that just because a horse can do a belly lift, it doesn't mean that they have a strong core or good spinal stability, because the function might be available to them, but then they don't have the strength, to say take that over to movement, or to they haven't kind of built up the muscle memory to actually improve their posture. It's like if you tell me to put my shoulders back and lift up from my sternum and engage my pelvis, like I can do it. And ideally, it'd be great if I can maintain that all the time, right? Then I'm going to have improved spinal support and improved core support. But just because I can do the motion doesn't mean that I have the strength to, or the patterning perhaps,
Yeah.
for that to become part of my everyday life. And that's what we're aiming for, is that we're improving a horse's posture and their ability to hold themselves in that posture over time, so that, when they are standing in the paddock, we see a different horse to what we saw before. Like we see one that is just standing like a ballerina, like
Yeah.
they're holding themselves up, they've got good limb alignment, they're actually lifting at the base of the wither, and they're just able to do that in everyday life. So and we're looking for that change to happen. So if you think that you're good in getting a good quality of belly lift, then you should see that change happening to your horse in the paddock. If your horse, the posture is kind of staying the same, and you're not really seeing kind of an improvement in the top line and the core, well, then there's probably some other reason for that. Like it could come back to hoof balance, and their hoof balance doesn't support improvements in the posture, or it could come back to just what they're doing in the paddock, or old kind of compensation. So yeah, just thinking about that. You mentioned before about using a hoof pick.
Yes. As a
So what do
kid.
you think about that now?
Um, it wouldn't be my go-to tool for a belly lift. My learnings have expanded greatly since I was in year 5. So definitely, that. And I do actually remember, that we were, using our hands, and it wasn't enough to get the horse to lift. Like they wouldn't lift up through their spine. And so then it's essentially, how do you get them to do that? And that's when you would graduate to a hoof pick. And so, um, I wouldn't do that now. I'd be looking for, why is the horse not able to lift, just from, quite a good scratch too, still not able to lift. So, a common mistake that we see, or, while you're on your learning journey, is often forcing the lift. So it becomes quite a reaction. It can be very jerky too. So the quality of your belly lift, the smoothness of it, is important to look at. But you should be able to be quite gentle with they're as if you're currying your horse's girth line and further back, and that should be able to get them to lift. So a jerkiness doesn't really indicate, and I'm sure I see often when you ask, sometimes people say, I do this exercise regularly with my horse, and it's actually become a learned response to lift, but it doesn't look
Yeah.
like they have, um, how would you say it, like bowed open in a
Yeah,
beautiful,
like the connection is not there. They're just doing it. And I guess that's where
yeah,
we've got to be careful of training these sorts of things, because we don't want to make it a trained response.
yeah, it's a gentle reflex, or a lengthening, like you were saying. So definitely, I feel strongly that not going to a hoof pick is a good idea, but returning to why is the function not there? How do we bring it back? And then graduate to building, like you said, the horse's ability to make a more suspended thoracic area a part of their everyday life.
Yeah, and if the horse, I mean, we're going to talk about signs to look for that indicate tension, but that just because if they can't lift, it's not the horse misbehaving, like it's not them being difficult and non-responsive if they're not able to do it. So if we want to go into, looking at the things of a good belly lift, and I guess, I've become more and more aware of this over the years because, yeah, I thought that it needed a fair bit of force before as well, but then especially doing it regularly with my own horses, then I've really seen that over time how that changes. And like you said, how soft kind of shampoo-like motion can create a beautiful lift, and that as it becomes more functional, then you actually need less, less force. And yeah, like they're just able to execute it quite easily. So they can respond really easily. Like you said, the whole body is involved. So you see a connection, like from the tail to the nose when it's done well. They can do it in a square and balanced stance. So, then they're able to maintain loading on each leg and in that kind of square position. The one thing that I don't really think people talk about is the extension of the head and neck. Now, it shouldn't drop forward, so we're going to talk about that, but when we do it in the dissection, we do a practical where we lift up through the sternum and we look at what happens. So technically, we're looking at what would happen in a belly lift. So you'd get a lifting of the sternum and engaging of the core, and then that creates a lifting through the back. But what happens when you do that to the head and neck is it comes into a like neutral open position. It takes all the stress out of the nuchal ligament and the upper like neck muscles. The lower neck muscles would be involved, but yeah, there's a real opening and there's a lifting of the base of the neck and then an opening of the gullet and a kind of a gentle reaching of the head and neck while the back is lifting, and then you've got that kind of rounding connection. And so that's really important to look at the head and neck and the legs when you're asking for a belly lift. What else could you look for that signs of connection?
Yeah. I just wanted to add in the dissection, doing that thoracic sling exercise, it always becomes very obvious, as you always say, talking to people, that the head and neck is a product of the posture that's coming through that thoracic sling. So, the tension coming up to the head, throughout the neck, and the muscle balance as well, where the horse is engaging and where it's able to be telescopic in its motion. You get that telescopic kind of extension and lengthening through the neck and the gullet. So yeah, the head and neck is a result of what's happening further back. Other things that you'd be looking for is abdominal muscle activation. So the horse should be able to gently engage those abdominals and they'll lift, and you have a gentle tension that comes in around the rib cage and the back lifts up. When you see like really big lines of tension through the abdominals, that's a really strong indication that the horse is bracing and is not comfortable while they're giving you that motion. Another good thing that you'd be looking for is when you're doing your shampoo sort of curry motion underneath the belly, if you can just tip your head up and have a look at the back and see that it's raising up. Doesn't have to be a huge motion, but that something is there that means there's a range of motion that you continue to move into with practice is a really good sign. Similarly to the head and neck end, you've also got the pelvis end. The lumbar extends into the sacropelvic area. And so seeing motion through that space as well, it doesn't have to be a huge motion, but once you can see it, there's a an
Yeah.
engagement that comes through. It's connected to the hind end. And you imagine the abdominals that you have got your hands on directly, they come back to the pelvis. And the muscles of the back, just even one muscle in particular that you can think of, the longissimus dorsi, connects straight into the front of the pelvis on the ilium. So it's a direct connection. So you'll see a gentle motion through that space. And also having a relaxed tail is important. So not having that tension carry through the spine. And overall, it should just be a smooth motion. It shouldn't be jerky or, as you said, like the horse shouldn't have to offload a leg or turn around to give you um, any negative behaviors.
Yeah, like they actually really enjoy it when they're comfortable. Like there's no biting, kicking, swishing of the tail. Yeah, it becomes a very pleasant exercise for them.
Definitely.
I was thought of something else and now I can't.
Well, I was gonna say, just on the enjoyment factor, I always notice. So if I meet a horse that I find has a thoracic restriction or a lumbosacral restriction, when you work through and bring motion in and you found comfort, so then it feels nicer to do the motion. When I come back and ask, so if I test for a belly lift or test maybe for pelvic flexion extension, say, and then you improve what's available, and then you come back and ask again. That is always a moment of connection with the horse, and it nearly always see a shift in them as a release, in their breathing, in their change in posture. Like it's a real integration. But it's once you've come back, you've tested, is this available? And now I'm asking you to use it and integrate it, and that's when there seems to be a big shift, and that yeah, it's always a release there for them.
Changes their body awareness as well.
Yeah,
Yeah, what I was thinking of is that some people struggle to see the lift through the back, but if you watch the back when you stop doing it, you might see the back drop back down, and that can give you a clearer indication of how much it's lifted if you're unable to see the lift. So watch the back as you stop and then start again. And the other thing is that you should get a continuous improvement. So like you do it once and then you stop and then you do it again, you should actually see a slight improvement. And the other thing is just their ability to breathe into that. Like if they can take a nice breath while they're doing it, that's even better because you've got even more connection through their body
yeah,
as opposed to like holding their breath.
yeah.
Um, and now, like, we're going to talk about, how do you look for signs that indicate tension?
Mhm.
So, I'll just first talk about the dropping the head and neck down, just because that's what Jelly tends to do.
Yeah.
So he's probably who really made me aware of it, and um, he does the belly lift very well. So he actually has a lot of lift through his back when I do it now. He never used to, but now like he does it easily and well. He only complains to me if there's an obvious restriction. But yeah, what he does do is he drops his head and neck down. And, initially you could think, oh, that's great. He's relaxed. Like he's lifting through his back. But then when I go to ask him, well, what's the base of your neck doing? It's dropped down. And so what we want is that when they're doing it, the base of the neck is lifted up. So for him to help him, I have to actually lift his head up and ask him to switch on the motion through the base of his neck. And the reason, I believe that he does this is because he has a chronic, I would say there's pathological changes involved in his right shoulder connection to his ribs. Whether there's some rib changes there, some base of neck changes on the right side, but he has a different motion through his right forelimb. I can treat it and improve it, but it always comes back. So it's an underlying structural challenge that he has for whatever reason. So, I can help him, I can mobilize that, I can be aware of it, but it is something that he has. But yeah, so that dropping of the head and neck is something to look for. What other things would you say?
Stepping away or, deciding that they really need to escape the pressure. So that could be with the forelimbs or the hind limbs. Sometimes they'll, it's just a very clear, I'm going to walk off now, or I'm going to take a few steps back. And that's just a very clear communication from your horse that this isn't comfortable, or I'm anxious and I'm anticipating, that either it's uncomfortable and, and there's lots of different things, is that uncomfortable? Are you, the comfort through the sternum? Is it through my back? And that's why, knowing your horse's posture, knowing their comfort is so valuable, and being able to see how they move and monitor them. Other signs include crankiness in general. So whether that's an ears back, turning to nip at you, biting, etc. They're all forms of communication, not misbehavior. So they're all very valuable things to take note of. Resting a leg, so offloading while doing the exercise. You can imagine that if your legs are planted and then you have been asked to engage your and lift your thoracic, then all of the connections through the body, they're going to have a bit of a change in orientation or angle. So there's going to be a slight shift in the dynamic tension of the body. So when that there's a shift in that tension, horses will often decide, oh, I want to offload a leg. So I know a horse that when you ask for a belly lift, she immediately offloads her right hind. And we know that we're on the right track when I come back and she doesn't. So that is something that often comes, the inability to stay square. So maybe shifting to a split stance behind or in front, kicking. That's one, coming up towards your hands. You want to be careful with your hands if you've got a horse that really doesn't like that. It's also a very, it's just really a strong indicator that you need to go back and figure out why the horse can't do that, because kicking is quite a strong response, really coming up, or being sensitive on the abdominal line as well. What other things do you see that kind of pop up?
Yeah, like it's just a jerky action. So, there's not a smooth flow with the motion. Or that it just drops back super quickly, So you'd like to see it that you lift and then when you let go, it just kind of gently goes back, to their neutral posture. And over time, you'd like to see that that change is smaller, because they're already in a improved state of lift, so there's not so much drop happening. Yeah, they're probably all the common ones that I see. I guess the other one is that there just isn't any lift. And I've probably had one horse specifically over the time, because I use it as a check, like post treatment, to go, yep, this is available to them, checking all the motions that are available to them and the comfort of those motions. And yeah, there's at least one horse that I know of that it wasn't, I could get it at the end of a session, but the owner was unable to maintain it because it was really small. And like, I can only assume that she had like fusion of kissing spine. And so if they have kissing spine, specifically if there's bony fusion, then it might be an exercise that's just never available to your horse. So, and we're going to kind of talk about, what could be the underlying tension patterns with why a horse can't do them. But yeah, kissing spine, and fusion, they're a great exercise for rehab of kissing spine, but it's just if you've got complete bone fusion, there's just a physical limitation there that you can't change at that point. But
Yeah.
the earlier that we get onto it, then like these exercises can be super duper helpful. If we were talking about, okay, like, we've talked about signs to look for that indicate tension, we've talked about signs of a good belly lift, but then people are going to be thinking, well, what's the best way? You said don't use a hoof peck and you said don't use force. So
Yeah.
what's our best way to actually execute this?
So you're general most way, what I would do is go out and come to the girth line and use a shampoo curry motion or a gentle sort of scratch come hither motion just across the central line of the belly. I don't want to use my nails and I don't want to dig my fingertips in, but I just want to um, ask and wait as well. It doesn't always need to be an instantaneous thing. And so, also, if you've been asking really hard and then you come out and ask quite softly, you might not get that response. But like Raquel was saying, that if you wait and you come back, you will nearly always see a change, and it'll come through if it's available for you. So using that gentle motion, or if you imagine you're doing a shampoo sort of curry motion with your fingertips, you can also, sometimes I'll start from opposite ends and bring my hands together. So that would be, one hand behind the girth, one a little bit further back along the tummy, and I would bring them together. And sometimes that just seems to be enough of a different action to what they're used to that it just sort of, they respond a bit differently. I would be, if you are having trouble, go and do a little warm up. So a 10-minute in-hand walk so that your horse is in, already a bit of a softened, warmed up sort of phase. And I would be asking them to see if they can relax their head and neck posture. So that might just be like asking gently with the leader on their halter, like, hey, can you just soften your head and neck so that we're not in a pattern of brace that's going to block any motion that we have. And I'd just be staying within their limits. So, if, like Raquel was saying, if you only have a little bit, I'm only going to ask you for a little bit. And if it starts to get jerky, that's okay, because you are allowed to test the boundaries sometimes and be like, where is the edge of this? And not be super timid in asking. But then once you can just see that limit and stay within it and look for improvement over time.
Yeah. And often with the head and neck thing, like when I first ask, I will generally put one hand on the head collar so that just in case I hit the, ask for too much, I've just got also for a
Good point.
safety hand.
Yeah.
But it's also a hand there for me to feel the softness or the brace in the head and neck. So, if I feel the head and neck kind of lift and brace, I can do a gentle side to side motion or a gentle like downward motion to soften. Or, in Jelly's case, I can help him keep it in a more neutral position as opposed to drop it down. And then the other thing I'd do too is just for safety, because it can be really helpful to like head a fair way back for some horses. Some horses they'll lift in that girth area beautifully, but then other horses you kind of go back more to the back of the abdominals and that'll create a really nice lift. But if you're going to go there, I'd suggest that you just, like in equinology, we say sweat the area. You just place your hand along that belly and make sure that it's not going to elicit a negative response, especially with mares. And then once you get comfortable, also make sure that your posture is really good. So, I'm standing, what would you call it, in kind of a split stance squat, with my back straight. And, so I'm supporting myself. I'm not leaning on the horse. And I guess I'm also thinking about my activation of my core and my breathing to help, the horse also understand what I'm asking for, and just so that I'm not kind of in a braced. Like the more that we can kind of demonstrate it in our own bodies, it's amazing how that actually helps the horses as opposed to going in there and being like, okay, you're gonna do belly lift now. And like scratch, scratch,
Yeah.
scratch, scratch. And then they're
Yeah.
like, oh, you come in, you like chill out, you relax, you bend your knees, engage your core, make connection with the head, make connection with the belly. Yep, everything's fine. And then gently start. And then, like you said, when they're comfortable, you can bring in the both hands. But for some horses, you might need to like go back to the base of the neck or go to the pelvis and do some other exercises to bring that connection through the entire body. You know, that's where I think it's great one to combine with a base of the neck lift and a pelvic rounding, because you're really kind of checking that whole connection there. So
Yeah. And just as a side note, for the sumo squat position, I find that when I'm bent over like Mr. Smithers out of The Simpsons, like I'm like, "Arr," and then I bring my hands under, I can't see their back. When you
yeah,
end up in that sumo squat position, you can always look up and see the lift. And I find, if when I remember that, I'm like, oh, that's right. I don't have to be crunched over like all just having a hard time of just like opening up my own body. So yeah, that sumo squat position allows you to, lean back on your haunches and look up.
yeah, and also gives you that grounding as well, which
Yes.
that's also what we're looking for from them. Like we're looking for a strong 4-point um, grounded limb position and foot contact with the earth. So that's also really beneficial for a good belly lift. If your horse can't do them, so I mentioned kissing spine is definitely one reason that could inhibit it. And you talked about like some ways that people can improve that. Like for example, they can warm up before asking for a belly lift. So a good 10 to 15 minute walk or a little bit of a trot, 5 minutes is all it takes just to warm up. Or you could also use mobilizations, so your carrot mobilizations dynamically, so you like keep them moving through their motion. That's also a great thing to do if your horse can't do a belly lift. Then start with spinal mobilizations, learn how to do them correctly and supportive for the horse, which we cover in the functional posture course. And that's your starting point. And then over a few weeks, you might progress to again asking for a belly lift. Or you can also, so in the T-touch method, you can also use like it helps to have another person for this though. So they stand on the other side of the horse and you have a towel underneath the horse's belly. You find where they're comfortable. And you just do a very, very gentle lift. Like it's almost a suggestion, you're not trying to lift the horse's belly. You're just like creating a proprioceptive input to the belly. And the important aspect of any of this, whether you're doing the full belly lift or you're using a towel to create awareness, is the off time. So when you take that towel away or when you stop doing the belly lift, you probably want to count to like 10 at least and give the body a chance to um,
Go back to neutral. A
get
true
back to
neutral breath.
neutral, and also the nervous system goes, what was that just happened? That was different. Maybe, yeah, maybe, some things can shift in here. And then when you go back and ask again, you get a different response, like an improved response. But if you don't give them that break time, so you just like belly lift, stop, belly lift, stop, belly lift, stop, I don't find it as beneficial as like belly lift, stop, 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 stop. For at the start, the longer you stop, the better. But as you progress, you might only give them a few seconds. But as you at the start, a little bit longer, you'll see, just watch their expression. If the horse is not paying attention, then you probably won't give them as long. But if they kind of look like, their eyes are thinking and they're quite present with you, then give them a bit extra time. Like
Yeah.
that's really beneficial. What other things could be underlying that a horse might struggle to do the belly lift?
So one being core strain or pectoral tension. So if you imagine they're the ventral muscles, the underside muscles, they have a lot to do with the lifting motion. They also form a large part of the thoracic sling, so thoracic area, which does engage during a belly lift a bit as well. So if you have any kind of discomfort or lack of activation of those muscles, it's going to be difficult. So that again is going to be one if you can assess their function. So try belly lift, didn't get one, I'm going to try again. Was there a change? That's one where body work is going to be very important for you, as well as your mobilizations. So doing your mobilizations, you can both, it's therapeutic for areas that have been under strain, etc., to start opening and moving again, once they're in a healing or healed phase. So opening up that motion again, and being able to start activating that space. Hyoid tension is a really big one. So hyoid, the bone that suspends the tongue and the larynx pharynx in the horse's head, there's quite a few muscles that run between that little hyoid all the way down to the chest, and also along the neck. And there's just a lot of fascial connections as well. So even if there aren't direct muscles, there's a lot of indirect connections between the rib cage and that space. So when you have hyoid tension, you see a lot of brace through the underside of the neck, definitely, and certainly that sort of tucking head.
Yeah. They'll
Yeah, and I
do
know.
like a flexion. It's like you think, oh, that some people might think, oh, that looks pretty,
Yeah.
but it's like, yeah, you see this reflex kind of pulling of the head and neck inwards.
Yeah. Yeah. And I definitely have seen, maybe for a different reason, but that dropping motion through the head and neck too. Like they're trying to shorten the distance sometimes between the two ends of those muscle and fascial connections, because you want to relieve the tension of it. But when you do that, you then reduce your ability to do your belly lift. So the hyoid is a very important place to check, and should always have function too, because it's so connected to the body. And of course, gut pain and discomfort. Having a sore tummy and being asked to do, an activation of your abs is bloody hard. I know for myself, as soon as I have a sore tummy,
It's like,
also when
ugh. Yeah, it just like pops out and it's just not comfortable. So that abdominal comfort
just,
is going to be really important. Sorry, you just dropped out for a sec there.
yeah, I thought you, so yeah, I'm not sure what you said, but that lower back discomfort really pops up, especially for me and for horses too, and carries through. They have to hold their belly up all the time as well. So, horses don't really get a break if you have a sore tummy. So it's definitely something that you want to get on top of and just figure out, does my horse have a long-standing tummy issue, whether it's, a bit of discomfort, ulcers, they need more forage. There's so many things to consider, and hopefully we have episodes upcoming about the tummy as well. So yeah, they're definitely a big one to consider.
Yeah, also just because we kind of like moved backwards, the pelvic ligaments, so they're also going to influence the way that the pelvis can function in a belly lift. So the dorsal sacroiliac ligaments on the top of the points of the pelvis, but the ligaments within the pelvis that are connecting it to the sacrum. We talk about a good belly lift creates connection through the entire body, then you need function through there as well. And the other thing with pectoral tension and core strain, which you mentioned, is that they're both really common. It's really common for horses to do pectoral tears. It's really, majority of horses that I feel through the chest area have had some sort of injury. And like we see in the dissections, it's quite a complex overlaying of muscles through that chest area. And horses that slip in the mud, pull back, there's so many ways that they can strain through the chest. And also the abdominal connections. I've seen a few horses lately that it's like their rectus abdominis, which is the lower belly muscle, has dropped. And, I think we get a lot of strain in its attachment to the pubis, to the pelvis. And you can feel that strain in a lot of horses. Like Ellie, my young horse, she had an accident and she injured her abdominals on her right side, and her ability to do a belly lift or even a carrot mobilization is quite challenging for her. Like she can't get between her legs. And so, if she can't get between her legs with the mobilization and she's not finding them easy, then I'm going to struggle with the belly lift. So just, making those kind of connections there and then setting them up for success. And if you continue to struggle, you need to get some help with a, well qualified body worker to address and assess those areas that you're finding struggling with it. So it's really good. It's a really good therapeutic exercise, but it's also a really good indicator of where your horse is at in regards to core strength and stability as well.
Yeah, definitely. And you can ask your body worker too to give you a bit of advice. Am I putting my hands in the right spot? They should be able to give you a bit of guidance. But like Raquel said, this is the last week to join the Equine Functional Posture course too. So that's got a lot of guidance in it as well. If you go to use your belly lift, when do you use them? How do you integrate that, for your body work as well as with your horses?
Yeah, so I use it as a check in my body work, like generally post treatment. Because I don't want to make a horse cranky at the start. I think it's a bit of an unfair ask at the start of a session. But I'll generally use it at the end to see, okay, tick, 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 like they've got this spinal motion. I'm checking all of their motion availabilities and comforts. In terms of you, as a, with your own horse, you can use it as a pre-ride activation and check. So you don't ask them to hold it pre-ride though, like you're just looking to warm up the motion, to check for the comfort and the availability in the motion, to make sure they're not cranky. A horse that's like girthy often will have a cranky reaction with a belly lift. And so often I'll put the saddle on and I'll do it as a pre-ride activation then. So I might do it, 3 to 5 times, like give him a break and do it again. And then post-ride lengthening where it's more relaxing, it's more like you're just letting them kind of breathe into that motion, you're holding it for longer. So if they're comfortable, like you're not forcing them to hold it any longer than they're comfortable. So, I might be looking for 15 seconds and then I'll 15, 20 seconds if they're really comfortable, but often that takes a while to look a while to work up to. And then I'll give them a break, let them breathe, whatever they need to do. They might have a scratch, a lick and a chew, move around a little bit and repeat it and do that like 3 times. The space in between, specifically for the lengthening, is really, really important. So, yeah, they're just a valuable exercise and feedback. When else would you use them?
I suppose, you've talked about improving your core, top line, spinal stability. Yeah, I suppose just the same, activations to check if the motion is there. And I don't use them every time anymore, but just coming back to see, yes, it's still there, it's still available. Um, you know, it's just there's a lot going on as we've reiterated throughout the conversation. So I would say when to use them for me, just like all the things that you've said, really.
Yeah, and just remember that when we're talking about the core, the multifidi, which are the spinal stabilizers, have been shown to improve and hypertrophy and get bigger and stronger when, things like this are incorporated in the rehab program. Like the studies that have looked at the improvements in those spinal stabilizers have incorporated a number of exercises, but the belly lift has been one of them. So, activating the core is so important for spinal stability, and we need spinal stability to have core strength and stability, and then to just support the longevity of our horses in general. So, some takeaways.
That the belly lift is a valuable addition to your horse's routine, really. But being mindful that it is an assessment and an exercise, but it's not a workout. So it doesn't build your horse for strength, but it's an important part of, like it brings your activation and your engagement to that space so that your horse is then going to go out and use them. They've made it a part of their pattern, and you're going to try and make that more long-term and more permanent. And it should definitely be a smooth and comfortable action. So your aim is to improve your mobility, stability, and your strength using these. So those are, the benefits of a belly lift. And yeah, you're just looking for ease and smoothness. Does the lift flow through from the front of the horse's body to the horse's tail? And yeah, it's a really good exercise, and definitely an interesting thing that has been recognized throughout a very long period of time, and it's still relevant, and a useful exercise.
Yeah. Yeah, and I'd just say, go out there, give it a go with your horse and ask yourself, what motion is available and just create more observations within the exercise rather than just doing it as an exercise. Like actually connect with it, connect with your horse, sit back a little bit and really make observations of what's actually happening because that's where you can create the most change. The more we can observe, the more we can kind of change the way that we're doing things, the more we can recognize restrictions or discomfort, and the more we can kind of, just create improved communication with our horses by recognizing that. So
Wonderful.
awesome. Well, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. We'd also love for you to join the Equine Functional Posture course that's coming up. So this is your last week to join, and it's just such a valuable addition to your toolbox, and it will really help your horse. And last night we had a Q&A, and the changes that people have seen in their horses were amazing when they put all of this into play on a regular basis. So yeah, enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights.
And we'll see you in the next exciting episode.